I'm good. Don't worry. Has this ever happened to you? You're working on something and then, paper cut. But your friend can get a paper cut and be like, why is it that we feel pain from the same thing so differently? I'm Tarek, and this is Zoetic. Today we're here to ask, do people feel pain differently? Hopefully we'll change everything you know and feel about pain. Everyone feels pain. It's a warning system that tells you to stop doing something that can really hurt you. Like this. That looked really painful. The perception of pain actually comes from nerve receptors called nociceptors. Basically, we come into contact with pressure, punctures, bumps, cuts, kicks to the shins, life. Those stimuli are received by the nerve receptors and sent to your central nervous system. That signal goes up to your brain and tells you, ouch. Ouch. That's an angry ouch. We all have this basic physiological structure in common, and yet we all feel pain in different degrees. This is where something called pain subjectivity comes in. See, pain is not just physical, it's also psychological. How we feel it is shaped by our brain. Meaning our individual memories, history, thoughts, or anxiety can all change how we feel a painful experience. Our brains do a lot of work interpreting pain, and sometimes they go a little haywire. Take phantom pain. People who have lost an arm or a leg often complain about pain from the limb that is no longer there, months, even years after they've lost it. And get this, some folks can't feel pain at all. It's a condition called congenital analgesia. People with this condition can tell the difference between sharp and dull or hot and cold, but they can't tell the difference when one of those sensations is actually hurting them. That may sound great, like being some invincible superhero or something, but it's actually really dangerous. You see, pain is useful, and folks with congenital analgesia actually get hurt more often and rarely receive treatment because they never realize they were even hurt. Pain subjectivity doesn't just apply to how you feel pain, it also applies to how we perceive other people's pain too, which can cause problems in the doctor's office. Despite all the sophisticated medical machines in a hospital room, most doctors still rely on a simple chart to determine how much pain their patients are in. It's up to the patient to communicate whether their pain is non-existent or the worst pain ever. Like the worst pain ever. And because this is all totally subjective, a doctor's bias can sometimes get in the way of treatment. Several studies have shown that doctors perceive their patient's pain differently because of the patient's race. For example, when black patients are admitted to the ER with something that is definitely painful, like a broken arm or appendicitis, doctors didn't prescribe the same amount of pain medication they would to a white patient. Wait, seriously? Some doctors have even said they thought African Americans had thicker skin, so that a black person didn't feel as much pain as a white person. Oy. Which could be an explanation for why the rates of addiction to pain medication are significantly higher for white Americans than for black Americans. Whether we like it or not, pain is a part of life. But how we're treated when we're in pain, well, that depends. So what do you think? If you like this video, it wouldn't hurt to subscribe to Zoetic. I want to hear your stories. Is there anything else that you want us to cover? Thanks for watching, everyone.